My name is Angela Williams. I have been a nurse now for 7 years. I used to be an oncology nurse and now I'm an ICU nurse. Working in ICU, it's already stressful as it is, but then you add a pandemic on top of it. It just takes your stress level on a level of it probably is like a 4 and throws it to a 10 right away. I have my days. I definitely have my days. More to say the least, yeah.
The pandemic of COVID-19 in the hospital has been really, really dramatic. I've never seen anything like this before in my almost 30 years.
If folks could see in an ICU and see people on ventilators and see people dying and see their families who can't go in there and are scared for what's going on for their family members who are ill, they might take this more seriously.
It was like a war zone. I'll be walking a corridor in the ICU and I'll be looking at a room to my right or my left, and room after room after room, patients on mechanical ventilators.
Mi nombre es Elder Viator, soy de Guatemala y aquí está a mi lado mi amada esposa.
Llevamos aquí en Minnesota 9 años.
Tenemos 3 hermosos hijos y una vida muy feliz.
When we started to get more patients coming in with COVID, we quickly noticed that there was a disproportionate number of patients of color that were very sick. I remember a week where more than half of all patients with COVID at my hospital did not have English as their first language. And one of them was Elder. He was critically ill, he was moved to the ICU.
Sale un enfermero, creo que era, y me dijo, ¿verdad?, que en la condición en la que mi esposo iba, que ya él había visto que varios habían entrado así y que ya no salían. Fue un tiempo bien difícil. Los 2 meses, ¿verdad?, que él estuvo internado, a veces llegaba pues a mi mente de querer aceptar la realidad, decir, ¿y si se muere? ¿Qué voy a hacer? ¿Qué van a hacer mis hijos?
Papi, te amo. Te amamos todos y te extrañamos.
Mis hijas más grandecitas entendían la situación, pero el pequeño no. Él toda la noche se empezaba a preguntar en mi papá. Y ya le decía, yo está en el hospital. Era una cosa tan terrible que de veras no se le desea a nadie.
Leech Lake is about 225 miles north of the Twin Cities. This is a rural way of life here. Hi, my name is Vince Rock. I'm the interim health director. I'm also a member of the Leech Lake Band of Ojibwe. What everybody is noticing around here is the high amounts of funerals that we're having. COVID-19 has impacted us.
Oh, you made that look just easy. Here, baby. Here. Oh, my goodness.
It's good working with natives. I've worked with natives all my life. So I'm native, so.
Can you show me your teeth? Show me your teeth.
I look at the Well Child Visit as an opportunity to talk about vaccines and the importance of them. But ask caregivers, have you had your COVID vaccine? Are you going to get it? What's your thoughts on that?
On the COVID shot?
Yeah.
It's not for me.
Okay. Have you heard of any bad experiences?
I hear about it on the news.
Okay.
And I'm not the only one. Both of my older boys, they're not getting them.
They're not going to get it?
He's not going to get them for his kids, and his wife's not getting it. No.
Okay. Do you think it's not safe, or?
No, I'm just not getting it.
It's not going to do it?
Yep, it's not going to do it.
Okay, can you have them?
I know there's a wide spectrum of how we approach the vaccines. We're not quite sure why, but I'm sure there's trust issues.
So I don't know what the answer is to that, you know? I mean, because you could talk yourself blue in the face and, try and get people to understand, and they still won't.
we'll see how you feel about that when you answer questions about COVID.
We like to go out there and get their weight and height and screening like that. So I'll just get her hearing while you're here.
That's perfectly fine.
I'm Iris De La Rosa. I have worked for Tri-Valley for about 2 years, and I'm a program nurse. We do provide education about the COVID immunization and how important it is to get it. And if that's something they're interested in, we can get them connected. Because some don't have internet, some don't have a computer, some don't have those resources to do it.
I'm definitely not doing the COVID shot. I'm not giving it to my kids, especially Heavenly, because of her immune system.
Is there like certain like concerns you just don't, you have?
Because I say we've survived Ebola, SARS, anthrax. These have been like short-lived viruses. And then here comes this one that's just like kicking doors down and just taking lives left and right. So to be precautious, yes. I had my mask on, but a 2-year-old kidnapped it. So tendencies to like proceed with caution.
Yeah.
But as far as the vaccine, that's one thing that I stray away from, only because I've seen people already getting sick from it, even nurses and doctors.
But when you say that you've seen sick, is it the same as COVID where you had
Yeah, I've seen one nurse, she got the vaccine, and she said that she was experiencing the shortness of breath, felt just really laggy, tired, and just lost the appetite. She started to feel depressed because she wasn't around her family. She was isolated. To see her go through that after getting the vaccine, and it's supposed to be something to help, I don't think I want to venture down that road.
What about her if she would have got COVID? Would it have been worse for her? Would she have?
I'm pretty sure it probably could have been a possibility, but to know that she was trying to protect herself from getting it and that was the outcome.
I'm on my Facebook and I see doctor died from COVID vaccine or nurse died from COVID vaccine. I don't really read into it just because it could be something else and it was a coincidence. A lot of it's just fake news.
Vaccine hesitancy has been an issue for the past maybe 2 or 3 decades, certainly in the United States.
And I don't think everybody who is refusing the COVID vaccine is refusing for the same reason. There's some big themes we know, but I think it's important to try to understand.
But like I said, I'm not pushing it, just encouraging. And if at the end of the day, it's your decision. And
you see how the dynamic just changed real quickly.
that's fine.
It's awkward for you that I came off aggressive, kind of.
No, I've encountered people.
Because I'm not an aggressive person. That's just my demeanor.
Oh no, I'm not awkward at all. I understand when you stand your ground, you stand, and that's why I say I respect everybody's decision. You can't.
Yeah. Now, if you said, "Hey, today you got to get your rubella shot," go right on ahead. By all means, if you gotta get your MMR, go right on ahead. Tuberculosis, go right on ahead. Hepatitis, go right on ahead. Corona, I don't think so. Don't feel safe. Thank you, Izzy. You're awesome.
Fine.
Here, can you stand up and say thank you?
Thank you.
Thank you guys so much. And I will bring this just in case there's some families that don't attend here. They can at least be informed. So I can help spread the word too. Elbow to that. Elbow to that. There we go. There you go, mommy.
The biggest challenge for getting communities of color to get vaccinated is really the barrier of hesitation. I grew up in North Minneapolis. I'm African American, so working on health equity and issues of, for example, vaccination are really important to me.
And I think especially as a Black person, like I was raised to kind of question stuff.
As a Black person in America, you always have this low level, at least low level, maybe greater, of anxiety everywhere you go.
Black people have a hard time trusting doctors because of things that might have happened to them, their family member, or unfortunately the stuff in history, like you think of like the Tuskegee trials.
Hesitancy stems from what we all know as the Tuskegee study, where there were a group of men that had syphilis.
And so they followed these guys with syphilis to see, what was the course of the disease and how did it go. When the treatment for syphilis, namely penicillin, became accepted in the 1940s, they did not offer it to these people because they really wanted to follow the natural course of the disease. It gets worse because then this continued on until the 1970s, until somebody from the press published some huge story about it, and then the public was outraged. There was this systemic process of dehumanizing people of color, and particularly African Americans in this country, that has gone on for as long as we've been here.
When we have that as a major part of our history, it definitely will make us reluctant to think about, okay, so here's a new illness. Here's a new vaccine for the illness. So my name is Tito Wilson, and I own this establishment. This is Wilson's Image, Barbers and Stylists. We've been in business here on West Broadway Avenue for 8 years in this location. We offer haircuts, hair colors, hair graphics. We use the shop as well as like a safe space for a community to come in, have conversations with like elected officials. These are just like community engagement conversations. So, we use the barbershop for more than just cutting hair. You know what I mean? We really engage the community. The coronavirus, it comes out. And then we're talking about having a vaccination maybe like 8-9 months afterwards. I think generally it takes years for, effective vaccines to be produced for illnesses. And so now we're talking about a vaccine for a virus that's been around, 8-9 months. Very reluctant to take that vaccine, very reluctant, and rightfully so. Our history here in this country has not been friendly, you know what I mean? So absolutely, I was definitely reluctant about taking the flu shot. I didn't want to do it, you know what I mean? I haven't done it. And the coronavirus, same thing.
I'm Kelly Robinson. I've been a nurse now for 27 years. Black Nurses Rock. That's the name of the organization. I'm the president of Black Nurses Rock, Twin Cities chapter. We've been a chapter now for a year, just right before COVID hit the world. I'm also providing vaccinators for COVID-19 as well as testing for COVID-19. And they're all nurses of color. Our goal as an organization, as a group, as nurses, professionally, we want to make sure that we're on the spot and we're actually vaccinating people. But it's discouraging that in all of the vaccinations that we've done thus far, the percentage of African Americans, it's just extremely low. One of the biggest concerns that African Americans have was when the researchers and the medical community started to talk about the mRNA vaccine and that messenger component, which was so new in terms of the technology and the development. For an African American with comorbidities, I want to make sure that this is not something that's going to harm me later down the road.
So for the average person, vaccines are kind of a complicated science, no question about that. Ultimately, at the most basic level, the intent of vaccines is to give your immune system some familiarity with the infectious illness of interest, in this case COVID-19, so that when your immune system comes across it again, it says, hey, I've seen that thing, let's kill it, let's go after it. And all these vaccines are really focused around this, what's called the spike protein on the COVID-19 virus.
The virus uses those spike proteins to get into the cell of yours that it wants to infect. When people worry about, I'm going to get COVID from this, no, these vaccines do nothing but produce spike protein. There's no COVID in there. But that's what they all do. And they do it in very different ways. The two mRNA vaccines, Pfizer and the Moderna, they do it by sticking a messenger RNA into your cell.
Everybody's heard of DNA. That's sort of your cookbook for how do you make an organism that's in every cell of every living being on Earth. RNA is a step removed from that. It's essentially saying, let me take one recipe out of that cookbook because I want to make one thing. And so these vaccines work by taking that recipe and delivering it inside of another cell. Your own cells eat that up and then use your own cellular machinery to make something from that.
And they instruct that machinery to make spike protein, and that spike protein gets on the surface of your cell, and the immunity that it generates to that spike protein is the immunity that protects you.
Some of these whole virus vaccines, which are more similar to what we're familiar with in the past, essentially just do it by giving you an inactive form of the virus to attack, just not the protein alone. But at the end of the day, what I could tell the layperson is, if you wanted to know, well, gee, which vaccine should I get? I would say, get the one you can get soonest.
Nobody would have even dared to hope that we were going to have a vaccine as good as this one appears to be. It's miraculous. The amount of disease prevented is going to be huge.
NRC is the National Resource Center, and it is a project funded by the CDC through the University of Minnesota, seeking to develop resources for refugees, immigrants, migrants with regards to COVID-19. And so my role kind of within National Resource Center am now focusing more on vaccine efforts, whether it be education, access, or the whole spectrum in between among refugee and immigrant communities. What are the challenges being faced? How can public health groups, community organizations, healthcare teams provide access to vaccines among these communities, many of which have been already disproportionately impacted by the COVID-19 pandemic? Hey, Hoda.
Hi.
How is your day going? Well, thank you so much for taking a little bit of time to talk to me this morning.
I do think that there are more people interested in the vaccine. You know, they have a few questions about it, and I have reached out to so a lot of the
I was just kind of thinking of different ways that I personally could be more involved with the COVID vaccine efforts, and noticing how much misinformation was out there and what can we do to help people become aware of what the COVID vaccine is and how it can actually help them.
There is hesitancy, especially with my community, with Somalis. The younger groups feel, oh, we're very healthy. I exercise, so COVID will not happen to me, and if it does, I won't die, so why do I need to get a vaccine? The elderly people are saying that, oh, you know, if it's my time to die, and if Allah wants me to die, I will.
Given the trauma that some African communities have gone through when they were colonized by the Western world, they still have that problem. We still have that problem of trusting the Western world completely with our lives, our health, and all of that.
There was an unfortunate measles outbreak a few years ago. People were not wanting to vaccinate their children because of this belief that their children could get autism. And so this fear about autism, I think, kind of played into that measles outbreak. And then now what we have is, you know, there's already this mistrust around vaccines.
There's been a lot of media coverage about communities of color and trust around the COVID-19 vaccine, information that's being spread about the vaccine that's often false. This isn't a situation that's unique to communities of color, and it actually extends to everybody. My earlier work, kind of looking back through some of the research that's been published around vaccine attitudes in general, there are some interesting findings that found that among refugees and immigrants, for example, the longer they were in the US, certain communities would acculturate to the US, and with that came some of the US beliefs around vaccine and vaccine hesitancy. And so there is that concept too that we have to recognize as a society, is that trust and that communication is present in all of our communities, not just, you know, white or communities of color, but it's really something that needs to be addressed everywhere.
In Latin America, we are educated to be vaccinated since the time we are born. So it is kind of natural for us. And we understand, because it's been our history, that the vaccines have been helping our communities to be more stable health-wise. But we are in the middle of some sort of unfortunate series of events that are come together and confuse people.
Yes, it is different because it's a pandemic. It's was created in a year, and then all these people, adding a lot of myths and scare into our communities, and I think those are the major reasons why that they decide not to take the vaccine or kind of scared to even take it.
There is a lot of word of mouth that happens in the community. There's a lot of stories that folks have heard, or there's a lot of perhaps wrong associations.
It's a fascinating subject, what it is that actually convinces people to get vaccinated. Science guys like me talking about data basically don't convince a lot of people. So one science guy spouting data may convince another science guy, but mostly people come with their own conclusions and then go to these weird sources because they want reinforcement for the conclusion they have in their gut.
I think it's always a good thing to ask questions about medications and vaccines. There's nothing wrong with that. But if you are firmly against it no matter what, and you in fact believe that vaccines are terrible, I think that that's a group that's going to be really difficult to reach.
There is vaccine hesitancy or concerns which is circulating in the social media.
Given the way technology has become, people just cut and paste things, they create things and put out there to scare people.
Again, this is not just communities of color. They're concerned that vaccines have microchips and then the government's going to be tracking them.
Get microchipped with a vaccination.
Microchips?
A chip.
Chips. Bill Gates is somehow wanting to kill Africans by giving them the vaccine.
And then maybe that sounds crazy to you and I, but again, these are the fears that people have.
When you have that history, it doesn't sound silly to us. It doesn't feel silly to us. You know what I mean? It feels real. This may be really far-fetched, but I heard someone say that, they're injecting people with a strain of HIV.
They think that it's going to give them COVID.
It's COVID. You're giving me COVID.
They're testing it on us.
I heard that the vaccine is not that safe.
There are videos about a lady who got the vaccine and then fainted, and that turned out to be nothing related to the vaccine specifically.
Are we getting a diluted version?
They're using current aborted babies to make the vaccine.
The vaccine will infiltrate your DNA, and then you won't be able to have children and reduce your sperm.
So it will affect our fertility.
Is that true that alien substances are being used to develop the vaccine?
Messenger RNA is something that is going to be used to cause mutation.
That they will turn into a crocodile. They won't be a human anymore.
They've said if you take it, it's going to turn you into a zombie.
Don't become a zombie.
Oh, are you checking on me to make sure I've not become a zombie yet?
You got the vaccine, you never become a zombie. I was like, I would have been already a zombie.
All sorts of things that are, not true, but then again, they're being shared widely.
It's enough to make people that are reluctant remain reluctant and resistant to moving forward taking the vaccine.
Those are kind of the fears and the concerns that we have to combat, and that's the role of public health professionals and health professionals like myself to really speak to the science and really